I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Hello, and welcome to this episode of IDD Health Matters. We have with us today Bob Scholz. Bob, I'm so happy to talk to you, and I can't wait to hear your story. So tell us what you do in the field of IDD supports and services.
Thanks, Craig. So I work for the University of New Hampshire, the Institute on Disability. I work for a program called the National Center for START Services. We're out of the Institute on Disability at UNH. START stands for Systemic Therapeutic Assessment, Resources, and Treatment.
Okay, what does that really mean?
Yeah, so essentially the START program is a mental health program meant to help with crisis intervention and crisis prevention, specifically for folks that have intellectual disabilities and mental health concerns.
Okay, very good. So what's the reach of START? Where is it?
So START began in the late 1980s in Massachusetts, and since that time, we've expanded to numerous states across the nation, from California to New Mexico, Pennsylvania, New York, New Hampshire, North Carolina, really all over the place.
So a lot of different places. What are some of the? Or let me back up. Why was there a need for START? Would you say? What would you think?
So, when I began working in this field, I got out of school in the mid 1980s with an undergraduate degree, and at that time, folks who experienced disabilities didn't have equal access to good mental health treatment, access to hospitals, really access to anything that really assisted with their health and wellness.
Some might say that they still don't have great access. Yeah, it has. We still have a ways to go. It certainly has gotten better.
Yeah. And so in the Commonwealth of Massachusetts, there was an initiative to create a program to help address some of those disparities, provide some supports to individuals and their system of support for a group of folks that had been underserved for a number of years. When I heard that this program was sort of coming about, I reached out to my supervisor, Dr. Joan Beasley, who is actually the founder of the START program. And I asked her, I said, hey, if this comes to fruition, I said, I'd really like to be a part of it. It was sort of a casual side comment. It depended on so many things. Would our company get the contract or not?
Sure.
We did. And she took me up on my offer, and I have been affiliated with START in some way, shape, or form since the late 1980s.
So, Bob, what would you say are some of the successes of the START program, even if you have a particular case you want to talk about?
Particular successes. So, I think successes should be measured by the reason why the person was referred to START in the first place. Not all successes look exactly the same.
Very true.
When we first began the program, I think some of the biggest successes that we had is supporting folks that still live with their families, but the families were under extreme levels of stress. Sometimes there was a sole care provider in the home, and one of the programs that we opened up under the START umbrella in Massachusetts was a therapeutic resource center. Having folks who were living with their families come to the resource center for several days, maybe a week at a time, really help to preserve that placement with their family. And when folks have to move between place to place, there's a lot of trauma associated with that. And not for nothing, it needs to mean something when someone says someplace is their home. that needs to mean
Sure.
something.
Sure, that means a lot to all of us, right? That's one of the things I don't think we always recognize, but people with intellectual and developmental disabilities have the same desires, the same needs, the same wants, in many ways the same challenges, and sometimes greater challenges that we all do. We're all people,
Yes.
and we need to see everyone as a person first. And when we approach it from that place to start, no pun intended, it really, I think it changes our perspective on life.
Oh, I agree. I don't think the folks that we're supporting, that we have the opportunity to work with, are asking for anything special.
No.
They're asking just to be ordinary,
Yeah.
and have ordinary access to things that we all take for granted.
So what does the START model look like? Like, how does it work?
Yeah. So the START model, we sort of talk about the engineering of the program versus sort of the architecture of the program. So,
Okay.
So we have, without getting into, sort of the weeds, a lot of very prescriptive manuals on how a START program can be set up in a particular county or state. But within that, we need to be conscious of, the sort of cultural, geographic, demographic differences, and be able to design our programs while still meeting the fidelity of the START model, being able to meet the needs of the local community. So sort of within that framework of the National Center for START fidelity measures, there is some flexibility for states to sort of make it their own.
So you have a structure,
Correct.
but then that has to be maybe adapted a little or designed for the community that it's going to be implemented.
Yeah, when we begin working with a state, a county, or whoever, we always sort of we'll start out with a clinical team, and that consists of sort of your START coordinators, your clinical director, a medical director, some clinical team leads, and we start there. But we also have sort of, I guess you would call it, enhancements to the model. We have therapeutic coaching. We also have the therapeutic resource centers that I was sort of discussing a little while ago. Those do not exist in every program. Some START programs have coaching and a resource center. Some don't have coaching and they have a resource center, or they're just a clinical team. So when we develop these, we really look at what the local need is.
So when you say resource center, what is a resource center?
Yeah, so a resource center, we actually used to call it a START respite program.
Okay.
But it really, respite doesn't truly capture all that we do. So many years ago, we started calling our START respites START resource centers. And they are typically community-based, indistinguishable from any other house in the neighborhood, usually 4 beds. And we use those for folks who are referred to START, who either need a step down from a hospital diversion, placement after an emergency room visit, or folks who live with their families and need a break.
Yeah,
and have a place to go. The goal of the resource centers is, no one's there permanently. Everyone has to have a place to return to when the time's up for them to leave. The folks that come to resource centers, they're our guests. So as guests, you have a time that you check in, and you have a time that you leave. And
voluntary.
Yes, it's voluntary. It's not locked. It is subacute. And really, I think what makes the resource center sort of unique is that it is a positive strength-based immersion. So from the time that folks wake up in the morning until they go to bed in the evening, the day is full of therapeutic groups, activities, opportunities for people to work together, to live together, to collaborate together, and have a great experience.
So what kind of feedback do you get from people who have used the Resource Center or their families?
Well, so I can speak to, earlier on in our conversation, we talked about the impact it's had in keeping people in their family of origin. And I would just say a lot of the feedback, a lot of the positive feedback that we get are from families.
Yeah.
We hear from families, no one's ever listened to us before.
Yeah.
No one's ever taken us seriously. No one's ever seen strengths in my child. And just giving them a break, reinforcing for them the things that they've seen all along and they've been telling the system that they need help with. We acknowledge that and we work with them.
That's pretty powerful.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So one of the things I do on the show is I ask guests to tell us 3 things in 3 minutes. And I won't hold you to 3 minutes, but 3 things that you think can improve the world for people with IDD, supports and services, health and wellness, whatever it is. 3 things you'd like the audience to know about this field that you think can make it better.
So the first thing, I mentioned it earlier. If you have a place that you call your home, that should mean something.
Yeah.
And all the things that go along with that, being understood, being respected, feeling safe, and not worrying that next week, 2 weeks, tomorrow, next year, you're going to have to move somewhere else.
Yeah, somebody's just going to tell you need to go somewhere, right?
I think home needs to mean something.
Yeah.
The other thing that I'd really like to see improve is access to ordinary and routine medical care.
Mm-hmm. I can speak to that.
Yeah. I'm involved in a small grant project where we are linking people in the state of New Hampshire with needed health services. It's a small project. There are a number of states involved, but just the stories we hear about people not having access to simple things, dentistry.
Oh, yeah.
Being able to find an outpatient mental health therapist that has some experience or skill supporting somebody with an intellectual disability.
And I'll take that even further. A regular medical doctor, primary care physician, a hospital, you said dentist already, that has an understanding of how to provide good health care for people with IDD, because that's kind of what I'm really most interested in, is providing training and education so that any person with any level of disability or no disability can present to any doctor's office or hospital system and receive a basic level of competent and compassionate health care. And that does not exist just yet. We've made some headway, but we've got a way to go.
Yeah. And so, am I restricted to 3 things, or can I
No,
sort of
you
go?
no.
They're like 3.5.
You can do 3.5 or 5.
Yeah. So one other would be having the folks that we support have more unfettered access to the community, being an active part of their community. I think that sort of ties in a little bit with permanence and having a home. When you have a community that you know is yours, I think it's a little easier maybe to go out and be a part of that community instead of sort of worrying about when the next shoe is going to drop, maybe when you have to move. So that's also one other piece. And it might have to stay at 3 because I forgot what my fourth one is. I was trying to be clever.
No worries. That was pretty good. Here's one thing that could be a 3.5 or 4. I can guarantee you people are going to want to learn more about the START program, and there may be listeners who might be interested in bringing it into their community and their world. How can they learn more?
They should reach out to the National Center for START Services through the University of New Hampshire Institute of Disability. We have a very robust webpage, and there are several folks listed throughout the webpage. If you have any additional questions, please contact, and they could reach out to us that way.
Great. It's a great program, and I encourage you to look into it for sure.
Great. Thank you.
Bob, thanks so much for taking the time to talk with me today, but more importantly, for the incredible work that you do in this field and the impact that you have on the lives of people with intellectual and developmental disabilities.
Thanks. I appreciate it.
Great talking to you.
Good talking to you as well.